Hi, in this video, I'm going to be talking about health literacy. What is health literacy? What does it mean? Why does it matter? And what can you do to improve your health literacy? Health literacy specifically refers to your ability to understand and act upon information related to your health. So it sounds pretty straightforward, and you would think that most of us who can read and write would have high health literacy. It turns out that health literacy doesn't have that much to do with how much education you have. So we have PhDs who have low health literacy and people with fewer years of education who are exposed to medical terms, so they have greater health literacy. So it's different from regular literacy or ability to read books or magazines, for example. One of the things that we're trying to do at Yerbba is to help you increase your health literacy. And the way we do that is by using medical terms and then explaining them and repeating the pronunciation of some words. So when health literacy is tested, it's often done by having people read the word neuropathy. And if you can't pronounce it, that's considered getting that answer wrong. But it's important to remember when people, mispronounce a word, it's because they've only read it, they haven't heard it. Our hope is that videos like ours and other videos that are out there and pronunciation guides can help you become more comfortable with the often polysyllabic, many syllable words that are used in medicine. The next thing I want to make really clear is that if terms are being used that you don't understand, that's not your fault. We get really caught up in jargon. You probably have jargon in your world too, things that I might not understand, and then I expect you to understand terms that I use every day. So we sort of get warmed in the soup of the work environment and the terms we've used and become really facile with over many years. And we go to lectures and we listen to podcasts in medicine. And so we get to the point sometimes where we forget that this is a term most normal people, non-medical people, don't use. So it's totally okay. And it doesn't mean that your doctor or other members of your medical team will look down on you if you ask them to explain a word, repeat the pronunciation, write it down for you, for example. So those are all things you have a right to do. This is about your life, your body, your treatment. So I just want to encourage you to do what I call keeping us honest, making sure the words that come out of our mouth match your needs. I hope that makes sense. So what else do we know about health literacy, and why should you be interested in improving yours? We know that being able to understand written medical instructions and to complete forms helps with care coordination. So if you have a hard time completing medical forms, it's harder for you and your doctor to communicate with one another. It is always cool and fair game to ask for help completing forms, to ask your family members. I have lots of patients who ask a sibling, a child, a parent, somebody at the healthcare system, like a navigator or a nurse, to help them complete forms. It's easy to say don't be ashamed, but we often do feel ashamed if we don't know how to pronounce something. That's a quick way to make me blush, is to point out I've mispronounced a word, because we think that it makes us look foolish. It doesn't. It just means you haven't heard the word before. So get some help answering forms. If you don't know the answer, it's totally okay to say, I don't know. And then your medical team can help you answer those questions if they're crucial for your care. The other place where health literacy really matters is in understanding instructions that you're sent home with. And I'm going to start with medications that you are on. If you're given a medication that you need to take twice a day, that might be abbreviated, I hope not anymore, BID. That's Latin terminology, and that means twice a day. That should be translated into English as twice a day. Now, you might want to ask, is that every 12 hours? Or could that be when I get up and when I go to bed? Same thing if it's every 6 hours. Do I really have to wake up and take this every 6 hours, or can I take it at breakfast, lunch, dinner, and bedtime? We don't intend for you to wake up and take medications except in very, very rare situations. So ask for some clarification. I have been mortified to find that my patients were given the instruction to take it every 6 hours when I meant every 4. So I'm telling you now that we don't always write what we intend. The other thing that can be really confusing is if you're given medications that you need to take with food or on an empty stomach. That can be really complicated, and it is totally your right to ask for somebody to make out an actual schedule. So something on an empty stomach, you take at 7 a.m., eat your breakfast at 8, take the pills that you're supposed to take with food at the same time. So you want sort of a picture of before breakfast, breakfast, before lunch, lunch, 2 o'clock in the afternoon with a snack, etc. This is the responsibility of your medical team to help you. This is not your responsibility to try to figure it out. This doesn't have to be your doctor and your nurse. It can be your pharmacist. Pharmacists, this is what they do, and it's totally realistic and reasonable for a pharmacist to help you navigate all the medications you're on. Our hope, of course, is that we're not adding a lot of medicines without taking some away. But if you have an infection, or if you're having pain, or if you're on other medications for other medical problems, you'll want our help in figuring out when to take them. Other follow-up instructions might relate to when to call the office, what problems should prompt you to call. And you'll want to make sure that somebody goes over that with you in person, that they don't just send that out. It is totally cool to say, hold on, this is a huge number of pages of discharge instructions. What is it on here that I really need to know? What do you include for everybody that might not apply to me? And they will highlight or put a star next to the things that really matter. The things that really matter are medications and the instructions on when should I call the doctor? When should I call the hospital? Because that means we want to nip in the bud any potential serious complications or side effects that can make you feel bad and interfere with your recovery and your quality of life. I've covered a lot. Please don't hesitate to put comments below. Write questions, comments. We'll get back to you as soon as we can. If you want to learn more about what treatments you might be offered, don't hesitate to go to Yerbba.com to learn more and to get your personalized report. Click like and subscribe. That helps other people with the exact same questions get this information.